Dengue fever has been the most prevalent disease spread by mosquitoes to humans in recent years, and it remains a global health concern. Over the past 5 decades, the annual incidence rate of dengue hemorrhagic fever in Indonesia rose significantly. The incidence rate increased sharply from 0.05 cases per 100,000 people in 1968 to 77.96 cases per 100,000 people by 2016. Based on provincial mapping of incidence rate from 2011 to 2016, West Java on average reported the highest number of DHF cases annually. People who are immunocompromised or have had dengue previously are considered at greater risk of developing dengue hemorrhagic fever if infected again. The symptoms of dengue hemorrhagic fever typically include an acute onset of very high fever, redness of the throat, extreme muscle and joint pains, anorexia, vomiting, redness of the eye. According to the World Health Organization standards, the key intervention in treating dengue cases is fluid management, which involves replenishing plasma losses with crystalloids and colloids. First, the nurse's job is to regulate volume, drip, and provide proper monitoring, since the fluids that enter the bloodstream directly have the potential to induce significant and life-threatening issues if administered inappropriately, sometimes too much, too little, too slow, or too fast. Consequently, improved IV fluid management, for example by the use of technology, is required. The development of this device aims to design an Arduino-based real-time infusion fluid monitoring device. This device consists of 4 systems, namely electronic system, mechanical system, interface system, and software system. The electronic system is the minimum Arduino ESP32 microcontroller system with XKC Y25 PNP sensor. The mechanical system is the medium for the sensor, an infusion tube made of SS material. The interface system uses Wi-Fi, which is a facility available on the Arduino ESP32. The software uses C microcontroller as data acquisition, MySQL as a database with XAMPP applications, and Visual Code as the monitoring result display menu. The principle of work is to read the height of infusion fluid with ESP32 microcontroller as data processor. The data will be sent wirelessly via Wi-Fi to the MySQL database in the XAMPP application on the PC server, then displayed in real time in the form of graphs on the web page in the local network without using the internet. Thus, nurse can continuously monitor the patient's infusion fluid conditions remotely from the nurse station without having to do manual checks. This will reduce the risk of running out of infusion fluid and allow for faster response to patient needs. The system software consists of 2 phases, namely database design and interface design. For the interface system, ESP32 communicates with the server through a Wi-Fi network using the HTTP protocol, allowing real-time sensor data transmission. The design process of this communication begins by connecting the ESP32 to the available Wi-Fi network. Once successfully connected to the Wi-Fi network, the next step is to send the processed data from the sensor to the server. Then, this data is sent to the server using the HTTP POST method. The server then stores this data in the MySQL database so that the data can be accessed and analyzed. The data received by the server will be displayed in graphical form on the web page, allowing real-time monitoring of infusion fluid volume. Here is the display design of the software fluid monitoring. This provides clear information on the condition of infusion fluid in each room. The database structure facilitates effective and efficient monitoring. It enables infusion fluid volume data to be displayed in real time on a web page in a local network. The amounts of fluid that are full, half, and nearly empty are marked with the colors green, yellow, and red, respectively. Therefore, medical personnel can easily monitor infusion fluid status and take immediate action without manual checks. This monitoring system can help nurses perform monitoring from the nurse station, thereby reducing the heavy workload of nurses. In addition, this monitoring system helps improve the safety of pediatric patients receiving fluid therapy in preventing excessive fluids or shortages that can harm patients. It allows nurses to monitor fluid levels remotely from the nurse station instead of manual checks in each patient room. This decreases the physical workload of nurses as they no longer need to continually check fluid levels manually in multiple rooms. Overall, the system supports better patient care by making monitoring more efficient while also increasing safety precautions for pediatric patients receiving